If you're over 60 and noticing more senior moments, like forgetting names, losing focus, or feeling mentally foggy, this video might explain why. It's not always age. In fact, the real cause could be sitting in your medicine cabinet. According to a landmark study from Harvard and the Mayo Clinic, 8 of the most commonly prescribed medications for seniors have been linked to accelerated cognitive decline and increased risk of dementia. And these aren't rare drugs. They're medications for allergies, sleep, pain, anxiety, and even bladder control, often prescribed without warning about their impact on the brain. Millions of older adults take them daily, completely unaware of the long-term consequences. But emerging science is clear. Some medications interfere with brain chemicals vital for memory, decision-making, and focus. Over time, this interference can quietly erode your mental sharpness, increasing your risk of confusion, falls, and loss of independence. In this video from the Wellness Vault, we're revealing the 8 medications silently sabotaging brain health in seniors, backed by recent clinical research. We'll explain how each drug works, why it's harmful to the aging brain, and most importantly, what safer, natural, and doctor-approved alternatives exist. Now we want to hear from you. Are you or a loved one currently taking any daily medications? Drop a quick comment below and let us know which ones. You may not be alone. And don't forget to like this video and subscribe to the Wellness Vault. We post science-based health content every week to help you take control of your body, mind, and future. What you're about to hear might be surprising, but it could change your life. You might be taking one of these brain-damaging medications right now and not even know it. In fact, some of the worst offenders are sold over the counter and marketed as safe. Yet dozens of peer-reviewed studies show they may shrink brain volume, damage neurons, and increase dementia risk by up to 54%. Stay tuned, because we're not only revealing which drugs to avoid, but we're giving you natural, doctor-approved alternatives that protect your memory and cognitive function instead of destroying it. Let's get into it, starting with number 8 on our list. Number 8 is diphenhydramine. Diphenhydramine is a staple in countless American households, sold under brand names like Benadryl, Zizquil, and various nighttime cold remedies. It's often trusted for allergy relief or sleep support. But for seniors, this familiar drug could be quietly harming the brain. This medication belongs to the class of first-generation antihistamines, drugs that can easily cross the blood-brain barrier. Once inside, they block acetylcholine, a neurotransmitter essential for forming and recalling memories. For younger users, occasional use might only cause temporary drowsiness, but for aging brains, this interference can build over time, leading to serious cognitive consequences. Multiple studies have raised red flags. One study published in JAMA Internal Medicine found that seniors with prolonged diphenhydramine use had a 54% higher risk of developing dementia. The more cumulative the exposure, the greater the danger. And since it's available over the counter, many older adults use it regularly without ever talking to their doctor. Even short-term use of diphenhydramine has been associated with acute confusion or delirium in hospitalized elderly patients. That foggy, disconnected feeling after taking a nighttime cold pill isn't harmless. It may be a sign your brain is under stress. So, what's the better option? For allergies, consider newer antihistamines like loratadine or fexofenadine, which don't affect the brain. And for sleep, natural solutions like magnesium, melatonin, or guided relaxation are safer and often more effective in the long run. The truth is, just because a drug is easy to access doesn't mean it's safe for long-term use, especially as we age. Diphenhydramine might be one of the most underestimated threats to senior brain health. Number 7 is amitriptyline. Amitriptyline and other tricyclic antidepressants were once considered breakthrough treatments for depression. Today, they're frequently prescribed for nerve pain, migraines, and sleep disorders. But few seniors are warned about what these drugs can do to their memory and mental clarity over time. These medications act by blocking acetylcholine, the same critical neurotransmitter targeted by other high-risk drugs. In older adults, where natural acetylcholine levels are already lower, this disruption can have outsized consequences. What begins as mild grogginess can evolve into persistent mental fog, confusion, and even early cognitive impairment. Research from the University of Washington and other institutions has found a strong link between long-term tricyclic use and dementia. The risk rises with cumulative dosage and duration, especially for those taking them daily for months or years. Unfortunately, many seniors continue on these prescriptions indefinitely with little reevaluation. While these medications can bring relief from pain and sleep issues, they often come at the cost of mental sharpness. Seniors may not immediately connect their memory issues or confusion to the pills they're taking, yet the connection is often there, hidden in plain sight. There are alternatives that work just as well without putting the brain at risk. Safer antidepressants, natural sleep aids, and therapies like CBTI are all viable options. But the first step is awareness. Amitriptyline may offer short-term relief, but in the long run, it may quietly be trading comfort for cognition. Let's keep going. The next medication might be in your pill organizer right now. Number 6 is oxybutynin. Oxybutynin is commonly prescribed to treat overactive bladder, a condition affecting millions of seniors that leads to frequent urges and potential incontinence. It's marketed as a way to restore confidence and independence, but this relief may come with a hidden cost to the brain. Oxybutynin works by relaxing bladder muscles, but it does so through strong anticholinergic effects. That means it blocks acetylcholine, just like the other memory-disrupting drugs on this list. The trouble is, acetylcholine isn't just important for the bladder. It's vital for memory formation, learning, and overall brain function. Studies from the University of California and European medical journals have repeatedly shown that long-term use of oxybutynin is associated with structural brain changes, including shrinkage in memory-related areas like the hippocampus. Seniors taking these medications often report increased forgetfulness, mental fatigue, and in some cases, symptoms mimicking early Alzheimer's. This risk is especially concerning because many patients stay on bladder medications for years without being reevaluated. The symptoms they experience, mental fog, confusion, difficulty concentrating, are often brushed off as normal aging, when in fact, they may be drug-induced and potentially reversible. Newer bladder medications like mirabegron act through different mechanisms and may carry a lower risk of cognitive side effects. Behavioral approaches like pelvic floor therapy also show promise. But the first step is asking the right questions. If you or a loved one is taking oxybutynin, it might be time for a conversation with your doctor about safer, smarter alternatives. Number 5 is diazepam. Diazepam, better known by the brand name Valium, is a widely prescribed anti-anxiety medication that belongs to a class called benzodiazepines. While it can be effective for acute anxiety or panic, long-term use, especially in seniors, has been tied to alarming cognitive risks. Benzodiazepines work by enhancing the effect of a neurotransmitter called GABA, which helps calm brain activity. While that might sound beneficial, the downside is that over time, these drugs can dampen neural activity to the point where memory, attention, and even coordination begin to suffer. The brain becomes overly reliant on the drug's calming effect, weakening its natural processes. In older adults, this leads to significant issues. Research published in the British Medical Journal and other sources has found that seniors who take benzodiazepines long-term may have a 30% to 50% increased risk of dementia. There's also a well-documented increase in fall risk, daytime drowsiness, and slowed reaction times, dangerous side effects for anyone over 60. What makes this even more concerning is how easily dependency develops. Many seniors are prescribed diazepam during a stressful period, like surgery recovery or a loss, and then remain on it for months or even years. They may feel calmer, but at the cost of their cognitive clarity and independence. The key is awareness and gradual transition. For many, reducing dosage under medical supervision and integrating lifestyle changes such as mindfulness, light exercise, and cognitive behavioral therapy can provide the same calming benefits without the cognitive cost. Diazepam might quiet the mind in the short term, but over time, it could be silently dulling the very faculties that define who you are. Number 4 is diphenoxylate atropine. Diphenoxylate atropine, sold under the brand name Lomotil, is commonly prescribed to treat chronic diarrhea and irritable bowel syndrome. It combines an opioid, diphenoxylate, with an anticholinergic, atropine, to slow intestinal movement. While it can offer relief from digestive distress, it may also pose serious risks to cognitive health in older adults. The atropine component of this drug is a potent anticholinergic, meaning it interferes with acetylcholine signaling in the brain. Acetylcholine is the same neurotransmitter affected by drugs like diphenhydramine and amitriptyline, crucial for memory formation, learning, and clear thinking. Seniors already experience reduced acetylcholine levels with age, and drugs that further suppress it can have significant neurological consequences. Studies show that consistent use of anticholinergic medications, especially in combination with opioids, is associated with an increased risk of cognitive impairment and dementia. When taken long-term, Lomotil and similar medications may contribute to brain fog, confusion, and memory lapses that mimic early dementia symptoms. What's troubling is that gastrointestinal issues often lead to prolonged use of these medications. Because the discomfort is frequent, many seniors stay on antidiarrheals for months or even years without exploring the cognitive side effects. And when symptoms of forgetfulness or disorientation arise, they're rarely linked back to the medication. Safer alternatives include dietary modifications, probiotics, and ruling out underlying causes of chronic diarrhea. But the core takeaway is this: medications like diphenoxylate atropine can bring temporary digestive relief while quietly compromising long-term brain health. It's a trade-off no one should make unknowingly. Let's take a moment to recap what we've covered so far. We started with diphenhydramine, better known as Benadryl, a common over-the-counter antihistamine that's shockingly linked to memory loss and dementia. Next came amitriptyline, a tricyclic antidepressant still prescribed for pain and sleep, despite mounting evidence that it disrupts vital brain chemicals. Then we examined oxybutynin. Number 3 is clonazepam. Clonazepam, often known by its brand name Klonopin, is frequently prescribed for panic disorders, seizures, and sometimes restless leg syndrome. It's another member of the benzodiazepine family, like diazepam, and shares many of the same cognitive concerns, particularly for seniors. This medication is highly effective at calming an overactive nervous system, which is why it's popular for both mental health and neurological conditions. But its mechanism, amplifying the inhibitory neurotransmitter GABA, also suppresses overall brain activity. For aging brains, that suppression can lead to slower thinking, impaired memory, and diminished mental clarity. Studies have shown that older adults who use clonazepam regularly are at significantly higher risk of developing dementia and other forms of cognitive impairment. Like other benzos, it's also associated with an increased likelihood of falls, which remain one of the top causes of injury and death among people over 65. Even more problematic is that clonazepam often leads to long-term dependence. Many seniors begin taking it during a rough patch, such as recovery from illness or surgery, and stay on it indefinitely, unaware of its cumulative impact on brain health. Withdrawal can be difficult, which discourages patients and even doctors from tapering off. The concern isn't that clonazepam lacks value. There are times it's medically necessary, but its long-term use in older adults should be rare, closely monitored, and regularly reevaluated. If you or someone you love is on this medication, it's worth having a serious discussion with your healthcare provider about whether the benefits still outweigh the risks. Number 2 is alprazolam. Alprazolam, widely known by its brand name Xanax, is another benzodiazepine that's frequently prescribed for anxiety and panic attacks. It acts quickly, providing almost immediate relief, which is why many seniors end up relying on it during stressful situations. However, this this quick relief may come at a dangerous long-term cost to cognitive function. The drug works by enhancing the calming effect of GABA in the brain, but in doing so, it slows down overall neural activity. Over time, this can dull cognitive performance, especially in older adults. Seniors on long-term alprazolam therapy have reported memory lapses, increased confusion, and reduced mental alertness, all of which mirror symptoms of early dementia. Several large-scale studies, including ones published in the American Journal of Geriatric Psychiatry, have linked long-term use of alprazolam to an elevated risk of Alzheimer's and other dementias. Because of its short half-life, alprazolam can also cause rebound anxiety, leading to a cycle of dependency that further strains the brain. The fast-acting nature of the drug makes it even more habit-forming than some of its longer-acting counterparts. As a result, many older adults become chronically dependent without realizing how significantly their cognitive clarity is being compromised. It's a quiet erosion of mental sharpness that unfolds gradually, often unnoticed until it's difficult to reverse. Reducing reliance on alprazolam requires a careful, medically supervised plan. Many patients benefit from cognitive behavioral therapy, mindfulness-based stress reduction, or even switching to less harmful medications. The important thing is to recognize the risk and take action early, before short-term relief becomes long-term cognitive damage. Number 1 is hydroxyzine. Hydroxyzine is a prescription antihistamine often used for anxiety, nausea, or allergic reactions. While it's less commonly discussed than drugs like Xanax or Benadryl, its impact on the aging brain can be just as concerning. Many doctors prescribe hydroxyzine for older patients as a non-habit-forming alternative to benzodiazepines, but that doesn't mean it's safe for long-term cognitive health. What makes hydroxyzine particularly risky for seniors is its anticholinergic activity. Like several other medications on this list, it blocks acetylcholine, a neurotransmitter vital for memory, attention, and learning. In older adults who already produce less acetylcholine naturally, this can lead to confusion, brain fog, and even delirium with continued use. Numerous studies have shown that hydroxyzine and similar drugs may significantly impair cognition when used regularly by seniors. The effects might start subtly, a bit of forgetfulness here, difficulty concentrating there. But over months or years, those small changes can snowball into substantial mental decline that's difficult to reverse. Despite being non-addictive in the traditional sense, hydroxyzine is often prescribed on a long-term basis for anxiety or sleep issues because it doesn't carry the same stigma or strict controls as controlled substances. Its risks are often overlooked. Patients may not associate their growing mental fog with a medication that's just an antihistamine. For older adults, especially those already noticing cognitive changes, continuing hydroxyzine may not be worth the risk. If you or someone you love is taking this drug, talk to your healthcare provider about safer options. Brain health is too precious to compromise for temporary calm. We've now covered 8 medications, some over-the-counter, others prescription, that could be silently accelerating cognitive decline in older adults. From common antihistamines like diphenhydramine and hydroxyzine to anti-anxiety drugs like diazepam and alprazolam, these substances all share one dangerous trait: their ability to interfere with brain chemicals that support memory, clarity, and long-term brain health. Each medication we discussed plays a unique role in undermining mental function, whether by blocking acetylcholine, dulling the nervous system, or shrinking parts of the brain tied to memory. And while they may offer temporary relief for allergies, anxiety, or bladder issues, the long-term consequences can be devastating if left unchecked. If you've made it this far in the video, you now have powerful knowledge. You understand the hidden risks. You know what signs to look for. And most importantly, you're empowered to have informed conversations with your doctor about safer alternatives. It's never too late to protect your brain. Now we want to hear from you. Which medication from this list surprised you the most? Which ones have you or a loved one taken? Share your experience in the comments. Your story could help someone else make a life-changing decision. If you found this video helpful, please give it a thumbs up and subscribe to the Wellness Vault. We release weekly videos with natural solutions, expert insights, and the latest health breakthroughs to help you stay sharp, strong, and independent for years to come. Thanks for watching. Take care of your mind, because a healthy brain is your greatest asset.